All right, welcome back. Today we will be talking about gonorrhea infections, treatment, and this is uncomplicated. I know that gonorrhea can be spelled in different ways, but this is how they spell it up to date. I guess it's like the British spelling. I don't know, but yeah. So I'm aware of that. If anyone is wondering, gonorrhea. Anyways, a little bit of background for you guys, and probably review from your other courses. So the gonococcal infections are pretty common among sexually active men and women. The treatment has varied because of resistance, antibiotic resistance. So you guys can read through all of this. Like with all of these presentations, they're going to be quick and to the point. Make sure you know the bug and then the first line therapy. So the selection of the treatment must include consideration for drug resistance, like I mentioned. That is something that has become more of an issue more recently, and it needs to be able to hit the chlamydia, trachomitis, and mycoplasma genitalium. So there are increased resistance. So historically, they use more things like penicillin, tetracycline, macrolides, and fluoroquinolones. But that is something that needs to be taken into consideration. The cephalosporins are still pretty good to use, specifically the ceftriaxone. It's going to be your first line. It does have the lowest rate of drug resistance. There still is some issues, maybe depending on what part of the country, what part of the world you're treating. But like I said, they do recommend a dual therapy. So historically, again, it was monotherapy with ceftriaxone, but now they recommend a dual therapy. So they recommend the ceftriaxone as first line agent plus azithromycin. If they cannot tolerate the azithromycin, you can go with doxycycline as an alternative to the azithromycin. But again, your first line for gonorrhea, take-home point for testing purposes, is going to be your ceftriaxone plus your azithromycin. And if they can't tolerate azithromycin, doxycycline. So with the ceftriaxone, again, that's generic Rocephin. You do an IM, 250 milligrams, one-time dose. You can also, with the azithromycin, do a one-time dose. So you have a gram of azithromycin one time. So that's nice. And then if they can't tolerate the azithromycin for whatever reason, doxycycline is given BID for 7 days. So the benefit too of adding the azithromycin or doxycycline is that a lot of these people have a co-infection with chlamydia, so they have chlamydia and gonorrhea. And so the azithromycin doxycycline can help eradicate the chlamydia infection as well. Pharyngeal infections may be somewhat more difficult to cure and can be an important reservoir of infection. So pregnant women with uncomplicated gonorrhea should be treated with the dual therapy. So it's going to be the ceftriaxone plus azithromycin. And this is an instance for the pregnant woman. You do not use a doxycycline because those should be avoided during pregnancy. And then it's a little bit different. And then retesting, 3 months follow-up therapy. So with the penicillin allergic patients, you're going to have to go and look at the next slide. I know there's a lot going on here, but definitely go ahead and read through this table. There's a lot going on, but a lot of good stuff. And then this will explain what to do if the patient does have a penicillin allergy. And again, if it's a true allergy, true type 1 hypersensitivity reaction, because you guys remember the cephalosporins, which ceftriaxone is there is some cross sensitivity with a penicillin allergy and the cephalosporins. These people should be offered testing for HIV infection as well. If a person does have uncomplicated gonorrhea infections, they do not need to return for a test of a cure. So this is just kind of FYI. You guys can read through that. Treatment failure as well. Just go ahead and read through this. I'm not going to be pulling test questions from this for you guys. Treatment of sexual partners is essential for gonorrhea, so that's definitely something to be mindful of. And you can give the oral cefixamine and azithromycin through expedited partner therapy. Is it a reasonable approach? So that just basically means if the partner doesn't want to come in, you can give a prescription for these for the patient to give to their partner. That's the last one there. So like I said, focus on your bug and your drug, first line therapy. Pretty straightforward here. You have your ceftriaxone and then your azithromycin. And if you can't tolerate azithromycin, then you go with the doxycycline. So that is it for this presentation. Thank you guys for your time and attention. And always feel free to email me if you have any questions, comments, or feedback. Talk to you guys later. Bye.